Waking up to pee once in a while is normal. But if it's happening night after night, it can feel like your sleep is being stolen in small pieces. The good news is that nighttime bathroom trips usually have patterns, and patterns can be changed. The key is to figure out whether your body is making too much urine at night, whether your bladder is getting irritated, or whether something is waking you up first and peeing is just the last step. Those are three very different problems. They also have very different fixes. Over the next few minutes, you'll get a simple way to sort yourself into the right bucket. You'll also learn practical steps that often reduce trips without doing anything extreme. And you'll know the red flags that deserve a medical check. Let's start by naming the problem clearly, because the label matters. In medicine, it's called nocturia, and it's about waking from sleep to urinate, not just peeing late before bed. Moving to slide 2. Here's the most useful framework. Nighttime peeing usually comes from one of three buckets. Bucket 1 is too much urine at night. Your kidneys are simply sending more fluid to your bladder while you're trying to sleep. Bucket 2 is too little bladder capacity. Your bladder is acting smaller than it should, often because it's irritated or overactive. Bucket 3 is sleep disruption. You wake up for another reason: pain, noise, anxiety, reflux, breathing issues. And once you're awake, you notice your bladder and decide to go. The trick is that all three can feel identical at 2 a.m., so we need a quick way to tell them apart. The simplest is to look at volume. When you get up, is it a full, satisfying pee, or just a small amount? Full volume points toward bucket 1. Small volume points toward bucket 2. And if you wake up first, then pee because you're up, bucket 3 is likely in the mix. Keep that in mind as we go. Moving to slide 3. Let's talk about bucket 1. Your body makes more urine at night than it should. Normally, a hormone called ADH helps you conserve water while you sleep. It tells the kidneys to slow down urine production. But ADH rhythm can weaken with age, and it can be disrupted by certain sleep patterns and medical conditions. Another big driver is fluid shifting. If your ankles or calves swell during the day, that fluid can move back into the bloodstream when you lie down. Then the kidneys filter it out, and your bladder gets the result at midnight. Salt can amplify this because it pulls water with it. So can late large drinks, even if they're healthy. A useful clue is timing. If most trips happen in the first few hours after lying down, fluid shift is a common reason. If it's spread evenly across the night, think about overall nighttime urine production. The goal here isn't dehydration. It's smarter timing and less fluid pooling in the legs before bed. Moving to slide 4. Now bucket 2. The bladder is acting like it can't hold much. Sometimes that's because the bladder muscle is overactive. It squeezes before it's truly full, creating urgency and frequent trips. Sometimes it's irritation of the bladder lining. Common irritants include caffeine, carbonated drinks, and acidic or spicy foods, especially later in the day. For some people, artificial sweeteners can also be a trigger. Another factor is constipation. A full rectum can press on the bladder and reduce capacity, and it can also increase urgency. There's also the prostate factor for many men. An enlarged prostate can block flow, so the bladder never fully empties and you're back again soon. A key clue for bucket 2 is small volume pees plus urgency plus daytime frequency. If you're peeing often during the day too, that points away from just nighttime fluid and toward a bladder capacity issue. The strategy here is reducing irritation and improving emptying. Moving to slide 5. Bucket 3 is the one people miss: sleep disruption. You might not be waking because your bladder is full. You might be waking because your sleep is fragmented. Then, once you're awake, your brain scans for a reason, and the bladder becomes the obvious target. One major driver here is sleep apnea, where breathing repeatedly narrows or stops. Studies show sleep apnea is strongly associated with nocturia. It can increase nighttime urine signals, and it also causes repeated arousals. Clues include loud snoring, gasping, morning headaches, dry mouth, or feeling unrefreshed even after enough hours. Pain conditions can do it too. So can reflux, itching, hot flashes, or stress. Here's a simple test. When you wake, do you feel urgency immediately, or do you decide to go because you're already awake? If it's the second, improving sleep quality may reduce bathroom trips more than any fluid rule. This bucket often overlaps with the other two, but it's worth checking early. Moving to slide 6. Before you change anything, do one quick audit for 2 or 3 nights. It doesn't need to be perfect. Track 3 things: what and when you drink, roughly when you urinate, and whether each nighttime pee is small, medium, or large. If you can, note whether you woke up first or felt bladder urgency first. This tiny log often reveals the obvious. For example, a big drink with dinner plus herbal tea late can create a predictable 1 a.m. trip. Or, you may notice the first nighttime pee is large, but the second is tiny, suggesting a mix of buckets. If you want one extra data point, check for leg swelling in the evening. If socks leave deep marks, fluid shift could be part of the story. The point of the audit is not to obsess. It's to stop guessing. Once you see your pattern, the next steps become targeted. And targeted changes are the ones that tend to stick, because they feel logical, not restrictive. Moving to slide 7. Let's move into practical steps that often reduce nighttime trips, starting with fluid timing. Most people don't need to drink less overall, they need to drink earlier. Front-load hydration in the first 2/3 of your day, then taper. A common approach is to make the last big drink with dinner, and then keep evening fluids small and intentional. If your mouth feels dry at night, small sips are fine, but avoid turning it into a full glass out of habit. Also watch hidden fluids. Soup, watery fruit, and large smoothies can count like drinks. Another simple move is to avoid chugging after exercise late in the day. Rehydrate, but do it gradually. And if you wake and feel the urge, try a brief pause and a slow breath before you stand. Sometimes the urgency wave passes, not always, but often enough to matter. The goal is fewer awakenings, not a strict rule that makes you miserable. Moving to slide 8. Next, reduce bladder irritants, especially in the afternoon and evening. Caffeine is the big one, and not just coffee. Tea, energy drinks, and even some chocolate can contribute. Caffeine can increase urine production, and it can make the bladder more sensitive. Carbonated drinks can also irritate some bladders, even when they're sugar-free. Acidic drinks like citrus juices and some flavored waters can be triggers too. This is where a short experiment beats a permanent ban. Try a 2-week window where you shift caffeine earlier or reduce it and swap carbonated or acidic drinks for still water or a mild herbal tea. Then compare your nights. Also, pay attention to spicy meals late and large salty dinners. Salt can push fluid retention during the day, then increase nighttime urine when that fluid shifts. You don't need a perfect diet. You need a clear signal about what your bladder reacts to. Moving to slide 9. If fluid shift is part of your pattern, focus on what happens before you lie down. When you're upright all day, gravity pulls fluid into the legs. When you recline, that fluid returns to circulation and becomes urine. 2 simple strategies can help. First, get some leg movement earlier in the evening, an easy walk, or gentle calf raises. Muscle contractions help push fluid back up before bedtime. Second, consider elevating your legs for a short period in the late afternoon or early evening. Even 20 to 30 minutes can change the timing of that fluid return. Some people also use compression socks during the day, especially if they stand a lot. But it's worth discussing with a clinician if you have circulation or heart concerns. Also look at salt. A very salty dinner can worsen leg swelling and increase nighttime urine. You're not chasing no salt. You're aiming for consistency and earlier fluid clearance, so your kidneys do their work before you're trying to sleep. Moving to slide 10. Let's make bucket 2 more actionable with bladder training basics. If your bladder is overreacting, the solution is often to retrain the timing, not to push through pain. Start in the daytime. Pick a realistic interval between bathroom trips, like 90 minutes, and try to stick to it for a week. If you feel urgency earlier, use a short urge suppression routine. Stop moving, relax your shoulders, breathe slowly, and wait for the wave to drop. Then walk to the bathroom calmly. Over time, this can reduce the bladder's false alarms. Pelvic floor muscle training can also help some people by improving control during urgency. but it needs correct technique. If constipation is present, addressing it can improve bladder symptoms because the pelvis is a shared space. At night, avoid just-in-case pees every time you stir. If you truly need to go, go, but if it's mild, a brief pause can prevent training your bladder to wake you for small volumes. Moving to slide 11. For many men, nighttime trips are tied to prostate-related urinary symptoms. The prostate sits around the urethra, so when it enlarges, the flow can weaken. You may notice hesitancy, a weak stream, dribbling, or the feeling that you didn't fully empty. That leftover urine means the bladder fills to the time-to-go point faster. A practical habit that can help some people is double voiding. You urinate, wait 20 to 30 seconds, relax, then try again. It can reduce residual urine for some without straining. Another helpful piece is to avoid rushing the stream. Straining can irritate the system. If you're seeing a clear pattern of weak flow plus frequent night trips, it's worth discussing with a clinician because there are several possible contributors and the right evaluation matters. Also remember, women can have incomplete emptying too, especially with certain pelvic floor patterns, so the concept isn't exclusive. The main idea is simple. Better emptying often means fewer returns. Moving to slide 12. Now let's cover medical drivers that commonly show up in the background. High blood sugar can increase urine production, especially if you're also thirsty. Some medications can increase urination, including certain blood pressure drugs called diuretics. But the important rule is to never change medications on your own. Instead, bring the pattern to the clinician who prescribed them. Urinary tract infections can cause urgency and frequency, often with burning or discomfort. Interstitial cystitis or bladder pain syndromes can also cause frequent nighttime urination, usually with pain or pressure. Pregnancy, menopause-related changes, and pelvic organ prolapse can influence symptoms too. And heart or kidney conditions can change fluid handling, sometimes showing up as swelling and nighttime urination. The reason to mention these is not to scare you. It's to give you a checklist for when home strategies aren't enough. If nocturia is new, worsening, or paired with other symptoms, the safest move is to get evaluated so the underlying driver isn't missed. Moving to slide 13. Let's get very clear on red flags. If you see blood in urine, that needs prompt medical attention. If you have fever, back pain near the kidneys, or severe burning, get checked quickly. If nocturia is paired with extreme thirst, unexplained weight change, or new swelling, that's another reason to evaluate. Also pay attention to how often. Waking once per night can be normal for many adults, especially with age. Waking 2 or more times, consistently, is where sleep quality often drops and health evaluation becomes more worthwhile. Another red flag is sudden change. If you went from 0 to multiple trips in a short time, don't just assume it's getting older. And if you're at risk for sleep apnea, loud snoring, witnessed pauses, daytime sleepiness, bring it up. Many people chase bladder fixes for years when the main driver is breathing-related sleep disruption. The point is simple. Home strategies are great, but some patterns deserve a professional look. Moving to slide 14. Let's put it all together into a simple plan for the next 2 weeks. First, do the 3-night audit so you know which bucket is leading. Second, pick just 2 changes, not 10. For bucket 1, that might be earlier hydration plus a short evening walk or leg elevation. For bucket 2, it might be shifting caffeine earlier and doing a daytime interval plan. For bucket 3, it might be a sleep check, consistent bedtime, reducing late heavy meals, and talking to a clinician if sleep apnea signs fit. Third, track the outcome in one number. How many wake-ups per night on average? That's it. If you improve from 3 to 2, that's meaningful progress. If you improve from 2 to 1, your sleep can feel dramatically better. Keep expectations realistic. Some people will still wake occasionally, and that can be normal. The win is reducing the frequency and making awakenings less disruptive. Before you go, I want to hear your pattern. Do you mostly wake with a full bladder, or is it usually small amounts? Share full or small in the comments. And if you want more practical, evidence-based health breakdowns like this, subscribe. This information is not a substitute for medical advice. Longevity is built daily, not discovered later.